American Medicine Today. Brought to you by the Bonatti Spine Institute and Alfred Bonatti, MD.
Welcome to American Medicine Today. I'm Ethan Euchre.
And I'm Kimberly Bermel. We're here at Feather Sound Smiles in Clearwater, Florida with Dr. Amir Dowd, where they utilize advanced technology in dentistry, and he's going to tell us all about it. Thanks for having us, Dr. Dowd.
Thanks for being here. Appreciate you coming in.
We've got lasers, you do digital 3D impressions, you have a milling machine in the back.
Yeah.
You tell me, where do we start?
I'm very passionate about technology in general. Everybody's got a computer at their fingertips. And, certainly that translates to, medicine and particularly dentistry.
Dr. Dowd is passionate about utilizing the latest technology for better quality care of his patients, as well as a more enjoyable overall experience.
How does the laser come into play?
Sure.
Because you talk about not really having to use too much anesthesia. I don't know about you, Ethan, but...
Yeah, I'm a classic example of someone who had a traumatic experience as a child and doesn't particularly like going to the dentist.
Correct.
So, to be able to hear using a laser.
You certainly fall into a pretty large percentage of the population. A lot of people have had bad experiences. So what we try and do is change that experience.
Dr. Dowd is able to treat many cavities using the newest lasers and even reduce the need for anesthesia.
Well, how does that work? You're still doing a filling, you're still, working on the gums and things. Why does the laser not hurt?
Because with this particular wavelength of laser, we're able to utilize it in a way that has an anesthetic effect on the tissues.
I've had the laser teeth whitening. Is that the same sort of laser or something different?
When we're talking about lasers, anyone who talks about lasers, there's different wavelengths of light, and that's what a laser is. So with this particular laser, there's two certain wavelengths of light, and yes, we can use that for laser whitening. Different wavelengths of laser will have a different interaction with tissues. The soft tissue tends to have more blood and more pigmentation associated with it, and so one particular wavelength of laser will interact better with that. Whereas the hard tissue, we use a different laser that interacts with the water content in the teeth, and that helps kind of use it for certain things.
Is the laser more precise than using a typical drill?
Precision is in the hand of the person using it, so quite frankly, I think that, you can achieve very high precision using dental drills, especially the ones we have today. The engineering that has gone into them, they're 50% quieter. They really have changed.
That being said, there are some advantages with lasers. For example, they are able to selectively target the decayed part of the tooth using specific wavelengths on the laser.
So now we're leaving the healthy part of your tooth intact, and the more of your tooth that we can keep, the better.
Now, what do they sound like? Because I know one of the biggest fears, really, especially with children and things like that, is that loud wee of the drill. That it makes your skin crawl.
Sure. So there's still a sound associated with it. And, it's pretty much impossible in dentistry to turn off the volume. There's always going to be a sound. Now, it is a very different sound. With kids, I kind of tell them it's going to sound like popping popcorn, really. And that's one side of it, and the other side is totally silent. So that's more for the gum treatment, etc., and that doesn't do anything.
And you said to allay the patient's fears, you'll give them headphones.
Patient can listen to whatever music they want to. If they want to just have it play on our speakers, we'll play it. If they want to have it on some wireless headphones, whatever helps people get through this, that's what we're going to want.
Feather Sound Smiles also specialize in dental implants, which are replacements for missing teeth.
And I really like to emphasize for a missing tooth because it is a replacement for no tooth, not your own tooth. So if we can work with your teeth and save them and maintain them for as long as we can, that's our duty as a dentist. But in the event that you are now missing a tooth, there is a way for us to put something back in there that works like a tooth, functions like a tooth, almost feels like a tooth.
Can you do it years after the fact, or say you want to do it immediately after losing a tooth?
You want to try to get that taken care of as soon as possible. And the reason being, when a tooth is taken out, the bone around it starts to resorb.
Is there a difference between an implant and, say, like a root canal where it's a tooth on a post, or is that one and the same?
A root canal is basically when a tooth, inside the tooth becomes infected or broken, we have to treat, the root of the tooth is still there, and it's the internals. Think of it as the organs of the tooth. That's what gets treated. So it's really, a root canal treatment is an extended filling. An implant is when there's no tooth there.
Okay.
So in effect, and you kind of hit the nail on the head, that an implant is basically the same as a root of a tooth.
Now, you have some fascinating technology here when we're talking about those sort of implants that I guess, take a cast and then they all of a sudden turn it into a tooth.
Yeah, you scan it, right? Then you mill it out of like a block.
Absolutely. This is my favorite at this point. It's come out, it's full color technology, it looks fantastic. You get a very accurate representation of what is there, and you're able to see what I see, and I think that's a great aid.
Dr. Dowd uses the latest technology to take a digital scan of the tooth, using a special camera which takes hundreds of photos that are then transferred to a computer where a three-dimensional image is constructed.
And then we're able to use a milling machine that is going to take a block of ceramic or any of the other materials that we use and mill it in real time, and it's pretty quick.
This means patients can come in with a broken tooth and leave with a crown the same day.
I'm going to just show you how easy this is. Kind of makes this sound, and what that's doing is it's telling me that it's picking up the data that we want. If it's not seeing something, it will let me know. And what it's doing is it's slowly building a digital file of the patient's bite.
This process takes barely more than 60 seconds, unlike the 5 long minutes traditional impressions take, usually with a mouthful of uncomfortable material.
Feather Sound Smiles can also take digital impressions using a special scanner which gives real-time results, which is far more accurate than traditional paper strips.
It's kind of similar to the Dr. Scholl's, when you stand on your feet and it tells you all the sensors are. This is kind of one for dentistry. So using a very thin film, and it's connected to this device in the computer, we're able to actually analyze the bite in real time, graphically on the screen. Unlike paper, where it kind of just tells you where the marks are, this tells you how intense they are, when the teeth are hitting, etc. So it really helps us narrow things down in a really, in a great way. Trying to explain someone's bite to someone is not very easy. And this has made this much easier.
Ethan even tried out their on-site CT scanner. Does that replace films, bite wings that you try to set back in your mouth and they don't fit, and then they cut the inside of your mouth? Yeah.
It does not replace those. So what a CT scan is good for, it gives us a global overview of what's going on. It helps us see things three-dimensionally. X-rays are a two-dimensional image of a three-dimensional object, and none of us are two-dimensional. And so they help us find out, okay, is there some active gum disease going on? Is there a cavity? Is there an infection at the bottom of the root? Those are what the traditional X-rays are good for. They're very intricate and they're very specific. Whereas with the CT scan, we use that to find other issues. If there's missing teeth, we want to know, okay, how much bone do we have? Are we able to place something in there? And from that, we can make a surgical guide based on the CT scan.
What I really like about what you do is you are kind of a tech geek, and the fact that you're willing to invest such a big expense up front, but if you know the technology's out there and you're not using it, that makes you unhappy. Because someone else is probably using it, and that means they're doing not necessarily a better job, but they're using tools that you should probably be using.
And that's really it. And I think ultimately, when you go to dental school, you become a dentist, and then when you leave dental school, now you have to work in the real world. And for me, it's a matter of I want to invest in the best possible technology because I make a personal investment into every patient. And so my practice must reflect that same approach.
All of the procedures at Feather Sound Smiles are covered by insurance.
When we use a laser, when we use a scanner or anything, this is technology to help us provide you with the best possible service. It doesn't cost you anything. This is an investment that I've made in my practice because I want to do things a certain way. As far as insurance is concerned, if you're getting a crown done, it doesn't matter if we make it here on the same day or whether we send it to the lab. As far as they're concerned, it's, the procedure is the procedure.
And if anyone watching wants to find out more, how can they contact you?
So if you go to our website, it's feathersoundsmiles.com.
Well, thank you very much for sharing your expertise and these new innovations that you offer.
My pleasure. I enjoyed having you here. Thank you.
Thanks.
Make sure you stay tuned because coming up after the break, you'll see our Back to Life segment.